The first will be Wyoming, and the second is Nevada. Each one has 7 minutes. And then we will have questions and answers through chat. Stephanie will handle that part. And I will be giving you, when you get to your 5 minutes is over, I'll give you a finger here. So you'll know you have 2 minutes left. So let's start with Wyoming, and we have Amy and Carly that will be presenting.
Well, good morning, I guess almost afternoon. My name is Carly Soul, and I am the Newborn Screening and Genetics Coordinator for the state of Wyoming. This is our state team currently. As I said, I am the Newborn Screening and Genetics Coordinator, and then we have Amy Zeke, who is the Women and Infant Program Manager at the state of Wyoming. New to our team is the Genetics and Metabolism at Children's Hospital, Colorado. And we also have Melody Miller-Mon, who is a consumer on our state team, and she is a mom of a child with a special health care need. Also on our team, but they're more in a kind of a resource capacity, are Canyon Hardesty and Eric Moody from our Wyoming Institute for Disabilities, also called WIND, at the University of Wyoming. And we have Kenneth Allen, who also is a consumer. He himself has PKU, I believe. Our activity to date, we did complete a RFP for genetic services at the end of October 2020. I'm not sure if everyone is aware, but just as some background, in Wyoming, we don't have any practicing geneticists or genetic counselors currently, so we do have to contract out for our services. So Colorado did win our RFP, and they will be our contractor for 2021. Prior to Colorado, since 2012, we were very blessed to have Dr. Longo and his team from the University of Utah helping us with our clinics. So they did a wonderful job, and we will miss them this next year. In partnership with the Wyoming Institute for Disabilities, WIND, we did complete a provider survey to kind of assess our needs, our genetic needs in Wyoming. And we really just kind of wanted to get a sense of what providers were aware of our genetic clinics that we hold, whether or not they referred to us or if they referred out of state. So we wanted to get a sense for that so we could do a little bit of education and outreach for that. I would say personally, for my program, the largest lesson that I learned is that whenever you think that you need to start a request for proposal or an RFP, especially if it has to go through the state, you need to start it at least 3 months prior to when you actually think that you need to start it, because everything seems to take a lot longer. And especially this last year, COVID did not help anything. For our time for genetics, we were happy to have the okay from Elizabeth DePrince Smith, who is a nurse practitioner at Laramie Physicians for Women and Children, and she practices in Laramie, Wyoming. And I know that that was very short and sweet, so I'm sure I have time left, but. I don't know did you want me to answer any questions right now, or I didn't know if there were any questions.
Yeah, they were originally going to go to our chat box, and I think we can still do that, but we have time here. So if you'd like to have some discussion, I'd use that this time for that.
Sure. I don't know.
Or Amy, if you have some comments too, we'd love to hear from you.
Carly, this is Janet. Can you hear me?
Yeah, I can hear you.
I'm just kind of curious, you mentioned your partnership with WIND and the provider survey. Have you gotten those results back? And if so,
yeah,
can you share some of those results?
Sure. And I know Eric's on this call too, and Amy, if you guys want to hop in too, feel free, but we did get the results back. And I would like to say that I was surprised, but I wasn't really that surprised to find out that despite any education that I had done, there were a lot of providers in the state that weren't aware of our genetic clinics. So that's something that I'm really going to focus on this year with this new contract, is really getting the education out to providers so that we can see about getting more referrals for patients, because I was receiving referrals from the same physicians, but it was nice to see that, you know, the physicians that I wasn't receiving referrals from, it was because they weren't aware of the program.
Thank you.
Yeah, and Janet, Eric from WIND is on the line, and he did put a comment in the chat box. They are working to make the data a little bit more digestible for everyone, but they were really fantastic in allowing us to put in some questions around genetic services and modify a survey that they were going to be sending out to their providers around overarching questions around family health and children and youth with special health care needs. So we were really appreciative of them allowing us to do that.
And we do have the data compiled. I think one of the striking things for me was that we had 126 respondents. Only 19 said that they were aware of the genetics clinics. So, you know, as you said, Carly, it was shocking, but I guess we shouldn't have been shocked. So, you know, I think it gives us a lot of clarity on ways that we can target getting the word out, improving access. So, and we are working on an executive summary now, so hopefully we'll have that pretty soon.
I have to say, I too am shocked knowing how long clinics have been ongoing up in Wyoming. I mean, for years. I mean, David Manchester did that clinic, I think, for 28 years. It's it makes me sort of curious if it's less pediatricians, and you probably will be looking at this, you know, more family practice, newer providers to the state than versus the kind of the old timers that we still work with and still see names coming across our services, or you know, why such a, you know, small number that are aware of the clinics. It's very surprising.
Yeah, it is. It's you know, it's not great news, but the other good side of it is that, you know, if it's a matter of getting the information out, that's something that's actually actionable, so we can do something about that.
Absolutely.
Yeah, but we will look at that and try to, you know, suss out what's really going on to the extent that we can. The other thing that was really good from the data is that we asked if they wanted more information, and over 50% absolutely said yes. So it gives us an opportunity for engagement that we didn't have before.
Very cool.
It would be nice to know if there is more awareness of the genetic clinic in close to the location of the genetic clinics, mostly Casper and Cheyenne. So, because obviously, if there is more awareness there, what it tells us is that one needs to have possibly more location for the genetic clinic.
Yeah, that's right, Dr. Longo. And I think that'll be interesting to see, because a lot of our referrals, as you know, they came out from, you know, the Cheyenne area and the Casper area. So that'll be interesting to suss out too, like Eric said. So,
yeah. And the sample that we got was very geographically diverse, so that could be part of it.
We'll see another really great opportunity is that we are building a really great relationship with our tribal partners in tribal health. And so we are starting to see a few more referrals come out of our reservation here in Wyoming. So that's been a big win for us as well, because we know that's a community that's been requesting services. So we're excited to see that continue to move forward as well.
This is all good. You know, you say it's shocking, and you know, but as you said, Eric, it's very actionable. And we look to the state team to be a part of this, and certainly working with Colorado too on the future. Thank you guys for the presentation. We will move on now to Nevada, Is Nevada up and running?
Hi,
And-
Joyce. This
and
is
we will
Yasmin.
have- Pardon?
Hi, this is Yasmin. I'm going to be sharing my screen here in just a minute.
Okay, I didn't see, that's what I was wondering. Jasmine, it will be presenting for Nevada, and we'll wait until, are you ready?
Yes, I'm ready. Let me just,
Okay, thanks, Yasmin.
yes. Okay, hi,
There she
everybody. My
goes.
name is Yasmin, and I am one of the co-leads for the Nevada State team, and I will be presenting our state team update today. So overview of our state team membership. We are happy and very privileged to introduce two new members. We have Dr. Robin Palmer, who is a certified genetic counselor located in Northern Nevada, and Dr. Nick Rashid, who is a pediatric hematologist located in Southern Nevada. We've also been working to expand our membership and resources for our team. We did connect with Project Echo Nevada, and they've helped us in the past as well, but we do have the program manager, Troy Jorgensen, who will be serving as a resource for our team. And also working to reach out to the Intertribal Council of Nevada, who is a nonprofit organization that represents our tribal populations in our state. So we want to try to get those collaborations going as well. And we've been reaching out. So in terms of our state team activity to date, we participated in the annual conference for the American Academy of Pediatrics Nevada chapter on October 24th. And that was a virtual event. It was a great way for our state team representatives to connect with pediatric providers in our state, as well as medical students. We were exhibitors at the conference, so we were able to discuss our vision and goals with of MSRGN and what we're trying to accomplish with our state team when we were networking. And we were also able to bring awareness to the 40 Clinic Initiative by posting the video, the promotional video onto the Nevada Chapter AAP website. So that was a great way for us to start this new grant cycle. We also want to focus on distributing resources that we had previously created in the last grant cycle. So we had made a Nevada Genetics Information Card, which is a small card that we hope to distribute with various genetics resources for providers in our state. And we also created a brochure outlining options and information on careers in public health genetics. And the purpose of that brochure was to target the workforce, so the upcoming workforce, and bring awareness to careers in genetics, since that's really essential in promoting our workforce in that area. So we did have an opportunity to have our brochure out there at Public Health Genetics Week in May. That was the last grant cycle. So now our focus is going to be distributing out the information to universities and providers and various groups. Another area we'd like to focus on as a team is addressing barriers to genetics care in our state. And so something that we had discussed was looking at broadband access and internet access in rural areas, because we have a pretty rural layout in Nevada. And it's important that we look at that, because lack of access to the internet could translate to lack of access to telehealth services and therefore specialty providers. So we've been trying to reach out to organizations to assess what are the needs for broadband services, quality internet in our rural areas, and then kind of come together to see what we can do regarding that. So we're still in the early phases, but that's something we would like to focus on. And as I mentioned, we are expanding our team membership, just trying to ensure we have a diverse and comprehensive perspectives on our team, which we currently do, but we could always work to improve that. Right. And we are also looking at something called the P10 project, which I will have Robin Palmer speak to that. I believe she's on the call today. But before we do that, just looking at that last point in terms of our time for genetics and our clinics, we've already have, I believe, one clinic on board, and we are working to get a second clinic on as well. So if Robin, if you're there, if you'd like to speak to the P10 project.
I am. Can you hear me okay, everyone? Good morning. The P10 project bridges hereditary cancer and maternal child health. I want to educate oncologists about P10 hematoma syndrome, or otherwise PHTS. Mutation in the P10 gene causes an autosomally inherited PHTS, which is a variable hereditary cancer and tumor syndrome that increases the risk for certain cancers, benign growths, and neurodevelopmental disorders. Many of the clinical features of PHTS are common in the general population. So PHTS is probably very undiagnosed. 90% of individuals with a P10 mutation have macrocephaly, or an enlarged head size, and about 15% of individuals with P10 mutation have mental retardation, developmental delay, or autism spectrum disorder. Women with a P10 mutation have 85% lifetime risk for breast cancer, which is on par with the BRCA1 mutation. The National Comprehensive Cancer Network recommends genetic testing of the P10 gene for women with breast cancer and macrocephaly. Personally, I doubt that many oncologists are measuring the head circumference of their breast cancer patients. So I want to table at the Reno, Nevada Oncology Society conference to educate about P10 and PHTS, encourage oncologists to measure head circumference of their breast cancer patients, refer their breast cancer patients with elevated head circumference for genetic counseling and genetic testing, and to promote MSRGN. I envision passing out tape measures at the conference that will be imprinted with Mountain States Regional Genetics Network. Thank you.
Thank you so much, Robin. And experiences as a state team, or our lessons learned. I'm pretty sure, just like most others, we've had to learn to navigate the virtual environment in terms of collaboration, which has been a little bit of a challenge, but we're managing. And just in general, COVID has taught us to be patient. We do understand that everybody has competing work priorities and other priorities in life. So we just have to adjust and, be patient with one another. And I think our team is working very well despite this challenging time for everybody. And last but not least, our time for genetics clinic and location. As I mentioned, we have one clinic on board, and that is Desert Valley Pediatrics in Las Vegas. We are reaching out to another clinic. I believe it's Positively Kids. So we're on track to get a second clinic, hopefully. And that concludes our presentation. And just want to thank everybody on behalf of the Nevada team for attending our presentation, and we're happy to answer any questions you have.
It looks like Jamie Stefanowski has a question. If you want to unmute and ask, that'd be super. Sorry, Joyce.
I was on mute. Thank you both teams for your presentations, very informative. And because we're a bit ahead of schedule, we can have some discussion now. If there are questions in the chat that you can share, Stephanie, that'd be great. And then let's just open it up to questions and have some discussion.
Sure. So it looks like Jamie had a question asking about identifying the need for assistance with broadband. What steps can you take to help with that? And Jamie, if I butchered that question, please feel free to jump in and speak up.
Yeah, I was just wondering, once they identify the need for broadband, what steps they take to helping the community that they've identified it in to access broadband. So say like the reserves, the reservations, they have a difficult time having access to telemedicine. How do they go about helping to rectify that and help provide it so that they can access the telemedicine?
So I thank you so much for your question, Jamie. I think at this point, we are just trying to get a broad overview of what the needs are and where we can be of assistance. I know we've reached out to Nevada Hospital Association regarding grants that they were already working on regarding telehealth, but I don't know if they're working with those grants anymore. I think it's shifted to another organization. So we're kind of in the early phases. But you do bring up a good point about, the tribal populations, because don't quote me, but I believe it's like over 97% of the tribal populations in Nevada live in rural areas. So that problem is compounded for them as well. So our outreach to the Intertribal Council of Nevada could include some type of component regarding internet access and broadband access. And I think it's kind of like just like our teams, it's a cross-disciplinary approach, because I was reading something as well that with students now mostly, learning from home, a lot of the districts have helped actually improve Wi-Fi access in rural areas because they're providing Wi-Fi hotspots and access to, low-cost internet solutions. So it might even be reaching out to those areas to see, what we can do to help. So it's a very broad overview right now in very early stages. So I hope I answered your question.
You did. You did. I'm just kind of wondering, I recently reached out to a Compassionate Colorado. I saw them driving down the road and I was like, I wonder what it is. And so we don't have a tribal representative on the Colorado state team. And so I'm talking with them and trying to figure out how or who we could obtain that representation for our team. And he was telling me some of their, the issues that they're trying to help with, and mainly food and water at this time. But he said, really transportation to just pick up the food and water at a central location, and, internet to access medical services, that they can't really get to a place and they still don't have access. So I was he was kind of hoping that there would be some way to help with that, because that's what they do. They help provide to the community, and Compassionate Colorado does. So with partnering with Colorado's state team, he was hoping to get a little help out of the situation. So I didn't know if you had any, or if there was anything that MSRGN is doing to help the reservations get access.
Well, for Nevada at this point, we are trying to reach out to our tribal populations, and that's with the Intertribal Council of Nevada. We're hoping to get some representation on our team, or just to collaborate to discuss what the needs are. So, that's the good thing about these types of events. We can hear from other states, similar situations, and what resources you're using as well. So at this time, we don't have a tribal member on our state team yet, but we are hoping to, and that's kind of just the overview at this point.
Thanks.
Other questions and comments? This is our chance to have that cross dialogue. So
I would, this is Jan. Early last year, I guess I would say probably about the time COVID started, this same issue about broadband access came up in New Mexico. And I know that there was conversation about being able to help and, grants and those sorts of things. So I guess I would, speaking of cross collaboration, wonder if y'all shouldn't talk to the folks, the New Mexico state team, and hopefully maybe have a chance to sit on the breakout session with them to see if they were able to accomplish anything, and if so, how. Because I know that same issue came up there pretty clearly at the beginning of COVID. So just a thought.
Thank you. That's good to know.
This is Catherine from Montana, and we are having the same conversations in our state team as well as broadband access, but also how to implement some of those resources. So I think it'd be great to, it sounds like there's lots of states that are in the same boat.
I agree. Texas, we're considering the same thing, getting representation on our team. How did you reach out? You know, what kind of got your foot in the door reaching out to the tribal communities?
We knew there was a need to do that, but we just hadn't taken the steps. And I think what really pushed us was at the co-lead roundup call, I think sometime last year. I'm sorry, I can't remember the exact time, but myself and the other co-lead, Hannah Barnhart, were there, and I think we'd heard from some of the other teams about, outreach, and I think it was probably the New Mexico team. So that kind of sparked our idea for the reaching out to Intertribal Council of Nevada and seeing how MSRGN can collaborate with them. So that's at least how I remember, I think, how we got the idea.
Can you tell us how, I know you're still in the early stages, but from a successful standpoint, it seems like what I have heard in the past is to really be able to get your foot in the door with tribal councils and with the tribes in general. You really do have to kind of engage an advocate within the council or those sorts of things. Have you been able to do that yet? And I don't know if you were able to identify someone to do that, hence you're reaching out to the tribal council, or how you've been able to do that so far.
So we reached out to the Intertribal Council of Nevada. Actually, one of our state team members had a contact with them. They had recommended them as an organization to reach out for regarding this area that we're interested to collaborate. So we've reached out to their executive director, and they were kind of in a period of transition themselves in terms of their offices and things like that. They weren't really ready to collaborate just yet, but still interested, and we're just in those early phases of reaching out to them. And we've shared information and resources about MSRGN, what the goals are, and just the fact that we're just open to starting a dialogue and collaborate with them in any way we can. So that's about as far as we've gotten at this point.
Thank you.
We still have about 4 minutes, so plenty of time if there's other questions.
Yasmin, can you clarify for, you said, so you had your booth at the AAP meeting, and it sounded like that was nice, particularly maybe for identifying in clinics interested in like the time for genetics and those sorts of things. But then you said your next step is to take particularly the brochures for careers in genetics and public health to academic centers. I guess I missed the next step and how you plan to do that.
So the good thing about the AAP conference was that we were able to get a list of the attendees who were at the conference. So our plan is to reach out to the attendees with at least the genetics resources card, because that has the resources that our team compiled together for providers in our state. With regard to the careers brochure, our original intention last grant cycle was to have an event at the university here, University of Nevada, Reno, and have students come in, just kind of have an informal get together and explain to them about genetics and if they've ever thought of a career in it and what possible paths they can take. But due to COVID, that shifted, so we put it into a brochure format, and we were able to showcase that in the Public Health Genetics Week website. But our next step now is to actually get those brochures hopefully out to the universities and other schools, just so students can have an idea about genetics as a career option, and that will hopefully help our, develop our workforce, because that's a big need.
Almost every university is going to have a career day, or sometimes two. And so you might want to contact your colleges that you have around there and actually set up a booth at their career day, because we get lots of traffic at those. And we've recruited lots of different students for different things at the career fairs. So those work out pretty well. It's something you might want to consider doing.
That's an excellent idea. Thank you.
And I would add, I think there's been a lot of discussion in the past from a genetic standpoint that we almost have to snag people's interest, students' interest in genetics, even younger than college. So there's been a lot of push from the standpoint of, like, at high school level, to get people sort of interested in genetics at sort of a young age. And maybe that's another option, is to look at, I don't know, even some of the high schools when they have their career fairs, or something like that as well.
That's a great idea. And that just shows there's a lot of possibility in how we can do outreach. And I do believe in our initial conversations, we were thinking about going to the high schools and things like that. But COVID kind of put a dent in our plans, unfortunately. But I think we can still find other ways. So thank you for all the ideas.
Something else you might want to consider is using like your School of Public Health, their communications classes and things like that, to help you create your brochures. So you don't have to, they can actually do the research, because we've done quite a few for Texas Children's Hospital and for a couple of different organizations. And we bring people on campus to those that are impacted by those disorders, and they meet the students, and poof, suddenly the students' work improved like 100 times better, and they're interested, and they go and spread the word about genetics and different type of illnesses. So that might be a really good outreach for you. And if not, you can always contact me, because we're always looking for projects.
All right. Well, thank you. Appreciate it.
Yeah, I would agree. If you could snag a public health student or someone, in a graduate program that needs a project, these are great. We actually, as you might hear later, have done that for the pop-ups, for the assessment of the pop-ups. We have a public health student out of Texas. So.
She's one of mine.
Yeah, I was going to say, you probably know that. And we love that. We love that. So.
Well, our time is up, and we thank you for this robust discussion. That was really great. And we'll move on to our second breakout room, and enjoy the rest of the meeting. Take care. Stay safe.
Absolutely.
Whoop.
Hey, Joyce, is all okay?
Yeah, I kept losing it, it jumps off and no, I don't know why, but I'm not going to touch anything. That's my way of solving it.
Well, everything looks good and sounds good. So whatever you're doing seems
Okay.
fine. We'll get started in about 3 minutes.
Mhm. And your sides are ready, Sandy? You're good. Hi, Susan. Good to see you again.
You too. This has been good. It's been fun.
Yeah, that's how I feel too. Glad to hear
Jumping
you say
around.
that. Yeah.
Yeah, it's amazing we can make this work, huh? But it works.
It's amazing. Thank you, Steph. Stephanie does it. She's very good at this.
Sandy, if you want to go ahead and share your screen, if you're ready, we can be ready to roll as soon as we are to the minute, if that's okay.
Okay.
So you're on mute. I can't hear you. I can see you.
Now, how's that?
It is great. So if you just start your slideshow.
Okay, so can I introduce first Stephanie and we'll go. Welcome to the Breakout 2. And this breakout is with New Mexico and Montana presenting. And New Mexico will start with Sandy Whistler, and she and Dale Alverson are the co-chairs for New Mexico. If right after she presents, we will have Jen Banna, who with Thomas are the co-chairs for Montana. So, and if you have questions, you can put them on chat, but hopefully we'll have, like the last session, we'll have enough time to have some really good discussion. So Sandy, take it away.
Okay, thank you, Joyce. So I'm Sandy Whistler. I'm a pediatrician and in New Mexico. Let's see if I can advance the slides. I take care of children with special health care needs and have done so for about 30 years. Our other co-lead is Dr. Dale Alverson, who's a neonatologist and a telehealth consultant. I think he's actually consulting right now with, was it Guatemala or something? So he's internationally known. We have quite a few members on our team, and it's a very diverse team, and so we're proud of all of our members. We have Dr. Mike Marble, who's the new geneticist at UNM, Kathy Salazar, who's with our Parents Reaching Out, so she's a patient advocate, Mallory Kwiatkowski with Zuni. She's also a well-known artist in New Mexico. Maggie Andrews is a parent and has a child with Prader-Willi. She represents the Prader-Willi Association Pam Hansen is a patient advocate, as well as Winton Wood and Jennifer Bartz. Josie Fu, she's the Navajo representative, former, and is a program administrator and Navajo, and is with Navajo Family Voices. She wears a lot of hats. We also have Dr. Susan Chacon with the New Mexico Department of Health. And Susan is a public health practitioner, and she's involved with New Mexico's Title V. Brenda Romero is also with the Department of Health in New Mexico, and she's a pediatric genetics nurse, as well as a state genetic coordinator. Dr. Susan Scott is an endocrinologist, neonatologist, and also has her law degree, and she's a professor emeritus. Carla Ortiz, newborn screening genetic nurse consultant. We have Dr. Kirsten Bennett. She's a pediatric dietitian and quality improvement specialist. Catherine Coakley, a UNM assistant professor with the nutrition program. And last but not least, Corey Mormon, consumer advocate for Laguna Pueblo. So the state team activity to date, we've been working with the Department of Health and Children's Medical Services to develop a network of telegenetics clinics. We're looking at using our public health clinics throughout the state as the originating sites. And hopefully these will be clinics in small areas in the rural areas of New Mexico, where our families will be able to come and not have to drive all the way to Albuquerque, which is quite a ways for quite a few of the families. We're also using this network approach and providing virtual services to complement the University of New Mexico pediatric genetics. That division currently does about, as Dale mentioned earlier, 36 on-site outreach clinics throughout New Mexico. And currently we just have the one geneticist, and he's stretched pretty far. This year too, we are also honoring a past member, Trish Thomas of Laguna Pueblo. She was very influential in a lot of the activities and all that we've done. She's a consumer advocate and also leader for Family Voices and tribal representation. So our experiences, it's been a real learning curve. We are learning to be very sensitive to cultural perspectives regarding genetic conditions, especially with our native tribes. There's certain words and descriptions you can use and others you should not. And so some of these, living with a condition as opposed to having a condition. So wording how you approach certain populations is very important. And when we are learning and working on this so we can appropriately engage the patients, their families, and other representatives of the tribes. We need to address protocols for emergency disaster response applied to patients with disabilities, such as genetic conditions regarding critical public health issues, including this COVID pandemic. Actually, Dr. Chacon and I are on another committee right after this that is talking about a lot of these same issues. And we just want to make sure that people, adult and children with disabilities, are heard in the state, especially when it comes to pandemics. And then we are working on developing mechanisms for patients and families to access genetic services when local access is significantly delayed. And so we're hoping to utilize the regional network, like the Mountain States Regional Genetic Network, to do some of this. And then last year we finished working with the Prater-Willie parent group, and that was a wonderful experience for all of us. We do have one clinic signed up for the Time for Genetics. It's Taos Clinic for Children and Youth up in Taos, New Mexico. Dr. Sylvia Villarreal is a really experienced pediatrician who takes care of most, if not all of the northern New Mexico special needs that are near her in her area. She does have a physician's assistant who is our contact person. His name is C. Morgan Swinehart. We also have several clinics pegged throughout the state, the 4 corners of the state, that we would like to add to this Time for Genetics network in the future. Thank you all very much.
Thank you, Sandy. That was a nice presentation on New Mexico. Our next presenter is Jen Banna. Jen, are you set up?
I am ready to go. I just need Sandra to stop. There we go.
There you are. Love the background.
Thank you. So let me get my screen up here. Is that one working for everybody? All right.
No, not.
There we go. I forgot to hit share. There we go. Is that better?
That's it.
Thank you.
Thanks, Jen.
Yep, I'm Jen Banna. I'm the co-lead for the Montana State team. And I think my other co-lead, Tara Thomas, is here today. I'm going to start with an overview of our state team membership. I'm just including our new members here. I want to make sure, first of all, to thank Tara Thomas. And I had actually put this on the slide, and I'm seeing that it didn't come up on this one. But I've been a little while without a co-lead, and I really needed someone to step up from our team to help with that. And Tara stepped up to help with that. She's another consumer from Montana. We were able to add 5 new stakeholders that really broadened our team and added some information, added people who had background in places that we were lacking. And we've been talking about the lacking, but we added people so quickly. We were really fortunate. So we've added Doris Barta, who's the director for the National Telehealth Technology Assessment Center. And she actually lives and works out of Montana, but she's in charge of the center in Alaska. So we were very fortunate to get in touch with her, and she's been able to help us understand telehealth and technology and broadband all across our state. We also added Catherine Hafliger, who's the director of early intervention and family education and support in our state. So we've got that younger Part C discussion. Amber Bell came to us from the state newborn screening. She's the program coordinator there. So she's in the Title V, also the Children's Special Health Services at the state level. Caitlin Patera joined us. She's an RN in genetics at Schroeder Children's Hospital, which is our genetic hospital in our state. And then Lauren Wilson, who is a pediatric hospitalist and vice president of the Montana chapter of the American Academy of Pediatrics, is bringing the pediatrician perspective to us. And she's also is very aware of what's going on across our state in different pediatric clinics and with different pediatricians. So our state team activities to date are really under construction. We aren't continuing any projects from the previous grant cycle. And with the new members of our team, we're still making connections and brainstorming. In fact, we had some great connections. One of our most recent meetings that helped us get our clinic for the genetics initiative. We continue to have a strong relationship with our Children's Hospital genetics program. And some of the ideas that we've been looking at for projects are providing equipment to help families with telehealth, providing funding to Indian reservations to assist with telehealth, providing funding to the Montana Children's Special Health Services to help fund families' needs around genetics and telehealth, and then also possibly providing funding to Schroeder Children's Hospital genetics to help fund families or providers' needs around genetics and telehealth. Schroeder has been participating in telehealth for quite a while. They're probably one of the leading groups in our state. And so they already have a good pattern for providing telemedicine. So our experiences as a state team, we just had an experience where we were trying to get our clinic up and going, and Catherine had reached out and they weren't responding. And it came across in one of our meetings that Lauren Wilson, the pediatrician knew the person there that we needed to talk to. So she made a phone call to them, and that's what it took to get that project moving. So we're learning about getting more done when we work together. It's taken our team some time to get to know each other and the resources and talents we each have. And I think that's made us a little bit slower maybe on moving forward on some of the other projects for our team. We're just still getting to know each other and learning about each other. We still have some crucial people that we'd like to add to our team, but with 5 new people, we're pausing right now and trying to be thoughtful before we take on additional members. And a big thank you to Catherine and Lauren, as I said, for getting our first clinic on board, and this just happened last week. So Sunnyview Pediatrics in Kalispell, Montana will be our clinic. They're in the northwestern part of Montana, and they're a department of a regional medical center there called Kalispell Regional Medical Center. So that's the update for Montana.
Thank you, Jen. In Montana, I just want to add, has accomplished a number of things last 3 years. So you have completed those, and now you are moving on. And it's been a real pleasure to spend time with the brainstorming and the ideas. And I think what you brought up about learning what each person has to offer, that has been such a benefit. I also want to just mention about the time for genetics. Originally, we asked each team, find that first clinic. And it was a bigger project than I think any of us recognized that it would be. And so the state's teams have had to spend a lot more time talking about this, trying to find the clinic that would be willing and would be appropriate. So a lot of thought and work went into getting this. I think what that's going to do is make it easier for next year, because we've had this experience and we've learned what the pitfalls are and how to make this really work easier than it did the first year. So of course, that's a thank you to all of the state teams for getting us our 8 clinics that we'll have for the upcoming year. Discussion, we really, this is such a unique time when we have people from all the different state teams. And Stephanie, do we have any questions in the chat room?
Not yet, but we're
Well,
ready.
then let's just go ahead and ask any questions.
So Joyce, I just wanted to comment on what you said about choosing the clinics, because I remember that's one of the discussions we really got into, was how much easier it would be to choose clinics that were already championing genetics. And so all of us had connections to clinics that were already doing a great job with genetics, especially the consumers, because the places that we've chosen to take our kids are already doing a great job. And so those would have been an easier place to step into. And so we really tried to stretch ourselves a little bit when choosing the clinics, rather than going to the ones that we already knew were doing a good job. And I think that's different than what we've done in the past, where we've counted on these previous champions of genetics to be in our court. We're trying to build that across the state. So that made it a little harder, because you had to introduce the whole thing to them.
Excellent point. Yeah. Other comments and questions? I think it might be helpful, Sandy, if and Susan, in talking about New Mexico with the telemedicine that the clinics there and your outreach clinics. I know this has been a long process trying between getting the correct information in the contract for the clinic at the hospital in Albuquerque to getting a new geneticist on board and all. How do you see this playing out in the next year for telemedicine with your state?
I don't know, Susan wants to start. Would you like to start, Susan?
So it has been a journey because we started out gearing up to do telemedicine with Dr. Heidenreich, who was very interested, and we were testing in the health offices, and we were pretty close to getting that off the ground. And then he retired on us, and then we had a pandemic, and so it's just been really a work in progress. And we were forced to, we do a lot of outreach clinics in New Mexico, like I know a lot of the rural states do. And we were forced to do more telemedicine in general. And we have Dr. Marble now, who's just still coming on board and trying to understand his preferences and how, he's getting to know all the patients in the state, and, it's a real onboarding process. So right now we're kind of doing a mix. And we have issues like everybody else with broadband and people not having internet access. So we're trying to really use the public health offices as that hub, but unfortunately right now mostly they're closed to the public, so it's really hindered our efforts. And so we're just going to have to wait and get through this and kind of go after the pandemic, and then kind of reevaluate what we want to do.
And I will add that Susan and I worked on, we had the successful transition clinic at UNM Hospital, and we were doing telehealth to several rural clinics using the public health office in the state at that time. And so we have some experience, which is good. I think once COVID lets up a little bit and things open more, we can rely on some of that experience that we've had before, working with the public health offices, having families come in with an advocate of some sort. And so I think that will be good, but it has been a challenge to actually get telehealth up and going, especially with the pandemic and the change of command and the geneticists at UNM.
And I see a question from Heather, if you want to just unmute and read aloud.
Yeah, hi everyone. So this is kind of it's I don't know, my question is a little convoluted. And I don't know, was hoping maybe we could get to more of an open discussion. So I work with mitochondrial disease, and we help families. So I'm based in Denver. We help families in New Mexico and Montana. We kind of serve as a hub for the whole Rocky Mountain region. And I'm wondering, for some of these more rare diseases, support groups and advocate groups don't necessarily meet state lines, right? They cover that entire region, and I'm wondering how we can collaborate to make sure that maybe our families that are in rural Montana, rural Colorado, rural New Mexico know that just because you're in a certain state doesn't mean that there aren't bigger organizations that can help you out. Does that make sense?
Yeah, it makes sense to me, Heather. One of the things that comes to mind is that I'm the coordinator for our Family to Family Health Information Center. And I know that all the states that are on the call have one, and so do all the territories. And so I think that's, if I ever come across a family with mitochondrial, because I know you, I immediately think of you. But of course, because we have so few families, again, like you were saying,
Right.
some of these rural states. So I think one way to do that is to make sure that the state family-to-family health information centers are aware of you, because sometimes they do get those, they take those kind of calls sometimes, and they can help send people your way. So because I wear that dual hat, if I ever hear about that, I automatically think of you, but I don't know that, the other states neighboring you would necessarily do that, or even the ones outside of this genetics region, right? Because, we're the most, that you're still neighboring a lot of other states.
Also, I think this reverts back to Dr. Alverson, Dale Alverson's idea, why reinvent the wheel, and being able to share information more effectively, efficiently with each other. I don't know if that would be a database or something, so we could point families to you, Heather, and say, if you have this metabolic disorder, here's a group of support that can help you. I know I send personally a lot of children to Denver. I used to work at Children's Hospital with Dr. Elias, and our families aren't coming back saying, oh, they have this neat group that will help support us.
Right.
And all that. I don't think the families are getting that information, and I certainly don't have that information. So I think it's a good project related to Dale's of trying to coordinate and getting us all together and share resources,
Hey, Sandy, it's Kathy in Albuquerque. So I'm like Jennifer, I coordinate the F2F for New Mexico. Every single one of us states has an F2F plus our territories. Family Voices usually helps a lot with that coordination. I actually got to know Heather because of this, and my daughter, Sydney, who has mitochondrial. So the unfortunate part about, some of these genetic conditions is I'm really grateful to know Heather and her group personally, but then also for the families that we serve in New Mexico. But we're having to take Sydney all the way to CHOP in Philadelphia now.
Wow.
Because we've run out of resources locally, or ideas locally on what else to do. And so, so the families with these really rare conditions are having to go out of maybe their regional areas because they're just so rare that you have to find somebody that even does this type of work. And you're having to travel, thousands of miles sometimes. And in my case, for both my youngest two, to CHOP. And so, but Heather, it's nice to see you. I know we've talked.
Good to see you, Kathy.
But yeah, so I mean, I agree with Jennifer. Sometimes the F2Fs can help with this information since we're all interconnected with each other.
I just think it goes back to, we don't want to reinvent the wheel, and not just for us. I mean, I'm saying this because we work with mitochondrial disease, but for all of these, more rare organizations. Kathy, I hate that we can't help you here in Denver, that you have to go all the way to CHOP. And how do we, I've talked to families who just, because, for us, we were in rural Colorado and we had to come to Denver to get the help that we need just because it was a hub. Fortunately, it was, 60 miles away versus 600 miles away. But that rural community just didn't have the depth of knowledge to really help us out. And so, I don't know. I think a database is great. I think, you can get to a point where you have too much data, and how do you disseminate between what is important and what isn't? And there's so much information out there. How do we create, what families really need at the moment? And it changes for everyone. So I don't know, it's hard.
I think that social media can help a little bit with that, Heather. Like when, Kathy was talking about reaching out to the F2Fs, if you send out something to the F2Fs, we're happy to post things on our Facebook page. We sometimes need a prompt to do that. Like, oh, hey, this is coming up again. But there's new families that get diagnosed that start following us. And then when we can reprompt like, hey, here's this great resource. I think that's another way to help. I did notice that Jesus posted another question in the chat, and I think it's for New Mexico. And he's saying he thought it would be hard to send or get healthcare into around the Native American reservations, more so when it's genetics. How is it done in New Mexico or on the reservations?
Yeah, kind of wondering.
Right now, and Susan, pipe in if you'd like, but we have some people on our committee, including Josie Fu, who is our contact with a lot of the different organizations and all on with the Navajo Nation and the Native American reservation. So we have several different people from different pueblos as well who are on our team that are trying to help us make those contacts and make those links. I know especially up on the Navajo reservation, you know, the distances and all are so far, and people, it's hard for them to get to medical facilities. But we may want to partner more with some of the pediatricians in Gallup too, because a lot of those children do come in to Gallup. And so that's a really good question. But we do have people who are integral parts of the Navajo Nation, Native Americans, the Pueblos, etc. And that's how we're trying to reach out.
Caitlin from Montana did just post over here in the chat that Tara Thomas, my co-lead, is the Montana coordinator for a program called Parent Partners. And they are in, yeah, go ahead, Tara. She just put her email over there, but you want to take this last little bit here, Tara, and talk a little bit about how that might be helping?
Sure. So one of the things that we've done in Montana, and actually it originated, we just started our 8th year, which is pretty exciting. It originated as a grant project through the Mountain States Genetics. They provided seed funding.
1 minute left.
Oh, okay. I'm like, what? Did I miss something? For the first 3 years of our program. And so it's an amazing program that trains parents who have children with special healthcare needs to work in pediatric medical practices. We also have a parent partner in we're adding a parent partner in our genetics group, which is extremely exciting. And then we also have parent partners in therapy realms as well. And what it does is it provides an opportunity for those families to connect with someone who has personal lived experience of that, and also personal lived experience, not only of the diagnosis, but of also the services that are available, so that they can help families navigate that emotional journey, but also the very complicated, oftentimes tangled web of services and supports that are available out there. So that has been one of the ways that we've been able to do that in Montana, and it has continued to expand and grow in collaboration with our DPHHS and Children's Special Health Services divisions. So it's worked really well in Montana, and we continue to work to expand it here. So if anyone has any questions about that or wants to explore what that might look like, please feel free to reach out to me. I put my email in the chat box.
Thank you all. Wow, was that timed well? And we'll head back into the main room. And thank you all. And Susan, I didn't want to put you on the spot, but